August 17th at noon. Thank you, everybody, for joining us here today. First on our agenda, we have to approve the minutes of the August 12th meeting. Representative Frazier, will you make the motion to approve the minutes?
So moved, Madam Chair.
All those in favor say aye.
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 Aye. Those opposed, nay. The motion passes. Thank you, Representative Frazier. Next up, and we're all very excited for this, it is a presentation from the Louisiana Department of Revenue. We've heard of all of the different models that different states are using to hand out or give out their hero pay. And the one that they were doing down in Louisiana looked very interesting to those of us on our committee. So we thought we'd have them give a presentation. We have first up, Luke, I think you're going first, Luke. Luke Morris, the Assistant Secretary from the Louisiana Department of Revenue. And then we have Kevin Richard, also from the Louisiana Department of Revenue. So I will hand it over to whomever's going first and just state your name for the record and proceed.
Great. Thank you, Senator. Luke Morris, I'm the Assistant Secretary for the Louisiana Department of Revenue, and we have a presentation prepared that we'd like to share with you. I believe it's on the agenda or the materials for the meeting, but I'm going to share my screen if that's all right.
Sure.
And Senator, I'm Kevin Richard, Deputy Secretary for the Louisiana Department of Revenue. We're sort of going to tag team this. So
okay.
Luke lead, and I'll just add my commentary as he goes along.
Got it. Thank you, Mr. Richard.
No problem.
Just a moment, please. All right. Can y'all see the presentation on the screen?
Yes.
Great. Thank you again, Senator, for inviting us. We have prepared just a few slides that goes through the eligibility requirements of our program. We wanted to share some of the background of how we got to where was the source of the funds that we were able to issue as rebates to our frontline worker population, as well as obviously share some lessons learned that we accumulated throughout the process. We are with the Department of Revenue, as you know, so this was a bit of a change to what we have historically done in terms of tax administration. The rebates were coupled under an existing program, but it was definitely a new area for us across the board. So let's see, here we go. So for purposes of this presentation, so we'll go through, like I said, what is involved with the rebate program. It was very temporary in nature. The application period was only a few months, and that was during the 2020 year. We'll walk you through how our legislature designed the eligibility requirements for the program, and then how we administratively developed an application process. And then on our back end, how we as the state agency charged with administering the program were able to review those applications. And we have some statistics to share as well. And then we'll end with some lessons learned from the process. And of course, we're happy to take any questions that the members may have. All right, so first up, just to give you some background on the program, it was created during one of the special sessions of our legislature last year. So we were in a regular session for the beginning of the year, which got interrupted by COVID-19 when it originally began last March. So this was a special session that the legislature entered into to provide funding resources for COVID-related measures. And then in one of those programs, in one of the calls for the special session, they added this frontline worker rebate program within our existing enterprise zone program. But the crux of it was that it was a one-time $250 payment to workers representing what they were going through at this time, right? So it's also based on the 8-week period that began shortly after the initial pandemic public health emergencies were issued. So that $250 was meant to be a supplemental hazard pay type item for these frontline workers, or essential critical infrastructure workers, as you'll see quoted there, in order to provide them with a way to compensate them for the time that they had to spend on the front lines of Louisiana. And then, like I said, and we'll discuss some more in detail, it was an application-based process. I know that is something that your group is considering as far as how to administer this, whether you would take applications from the workers directly, or if you would grant the funds through businesses or use third parties. Ours was strictly application driven, meaning that once the law was passed, once we issued the guidance, it was required of the frontline workers to submit their applications into LDR for us to be able to begin the process of issuing the rebates.
Right. And I'll just add that this was originally, when approved by the legislature on how to distribute CARES Act funding, it started out with a Main Street recovery program targeted towards small businesses. And that program was initially allocated $300 million out of the CARES Act funding. As sort of a compromise in the Louisiana legislature, 25 million was carved out from the local funding to fund this program, and 25 million from the state funding to come up with the $50 million. Because the thought process was, how do we assist those critical frontline workers, and at the same time recognizing the need for the impact of COVID-19 to our small businesses. So sort of a compromise, and we were charged with running, we being the Department of Revenue, with running the Frontline Worker Rebate Program. And Luke has some stats up there.
Yes, and that is going to be one major difference from the program we administered versus the one that you are set to administer. Our funding, like Kevin said, originated from the CARES Act from last year. I understand your $250 million is sourced by the American Rescue Plan. So there are probably some subtle differences in the definitions of what is a frontline worker, but we'll get to that in a little bit. But like Kevin said, this was the breakdown. Our legislature took that slice of our total CARES Act dollars and allocated them toward this fund. So based on the $50 million, there were the $250 payments were a set amount. It was either $250 or nothing at all. There wasn't any smaller amounts that could be awarded. So we were on a very strict first come, first served application process where there was only available funding for the first 200,000 applicants. So through that process, we had to make sure that when these applications came in, that we were taking them on that first come, first served basis, as well as issuing funds out in that same order. Back up just a moment. This is just a screenshot of what the bill looked like, but it had overwhelming legislative support. This was, again, I think it was signed into law in July of last year, which was one of our, I believe we were in our second surge at that point. So there was tremendous legislative support for that, which I'll explain a little bit later, which is also very important when we were working through these applications. And it took a little time to go through some of them. The public, the frontline workers, were actively reaching out to members of the legislature for assistance. So we worked very closely with our counterparts across the legislative district offices to raise awareness, to do outreach activities, and then to be able to answer and vet questions that came from the frontline workers. All right, so the eligibility requirements, these are all found in the statute that created the program. But the application period, first and foremost, was set to begin on July the 15th, and then it ran through October 31 of that year. I have some stats that will show you that we hit that 200,000 mark within a few days, but we had that whole time period to receive applications, review them, and then let the applicant know whether or not they had been accepted or if more information was required. There was a $50,000 income threshold put into place. So it was designed at those that have annual income of $50,000 or less. And then when it comes into what job categories were eligible, our statute pulled in guidance from CISA, the Critical Infrastructure Safety Guidelines, I believe, where there were certain job duties that were designated as essential. So that was actually incorporated into our statute, and then certain job titles were listed from there. But one thing that we found as as a bit of a repeating item is that just because a person's employer said that they were an essential employee, that was not the end all be all of their eligibility. It was, yes, your employer had to designate you as essential, but you also had to meet these requirements that we're going through. And then in that last bullet there, they had to be providing services in person. So if they were working from home or in an activity where they were not actually on the front line, that rendered them ineligible as well. But there's the 8-week period that I mentioned from March 22 to May 14. During those 8 weeks, they needed to work at least 200 hours within that frontline worker position.
Right. And I'll add that that 8-week period was very specific, because those were the 8 weeks that in Louisiana, everything was shut down. So we didn't just pull those dates out of a hat. Those weeks were selected because those employees had to go out. And if you remember those first few weeks of COVID, when everyone was nervous and scared about catching it, those people had to go out and work. So the legislation targeted those individuals who were truly critical, essential to keep things going. Luke?
So of those job categories, these were specifically spelled out in our statute. There weren't any definitions provided, of course, so we used through the emergency regulation process, we prescribed some definitions for these. But all of these job titles, they may look familiar. They were coming, while they were in our statute, they were sourced directly from that CISA guidance that I mentioned. So they're somewhat broken down by major classification, the first one being healthcare, the second one being more hospitality type services. But as part of the application process, each applicant had to identify what job category they felt. This is 1 of 2 and then 2 of 2 here. And I'll tell you, we'll get to a slide in a minute, but the grocery store personnel was by far the largest group of frontline workers that we had. I think it represented on its own about 1/4 of total applicants that were approved. So through all of this, I would say the biggest question that we received day in and day out was, do I fall within one of these job categories? And that would be my biggest point of advice, is that when you do select what job categories will fall within the Frontline Worker Program, that you give very good definitions to these programs to these jobs on the front end, so as to avoid there being confusion about whether or not a person qualifies. Does that sound right, Kevin?
Yes. Oh, definitely.
All right. So we, in terms of getting our program ready for launch, we did it on a very quick turnaround time. The legislation passed and we had just a few weeks to develop the system, both from the online application portal, but also, like I said, doing those outreach efforts and providing guidance on the front end, whether or not a person may qualify. So we took all of those eligibility requirements and put them into what was supposed to be a very simple, straightforward flow chart, and then you see what we have here. But this succinctly covers everything, following the lines of, you have to meet all of the income requirements, the tax filing requirements, the 200 hours, and then and only then do you get to that final step at the bottom where you have to be in one of those designated job positions. So we developed our internal system to handle as much of it could on an automation basis. So because we're the Department of Revenue, we obviously have access to everyone's returns and income information. So we used that to automate as much of this process that we could on the back end. But of course, there were more, I guess, subjective elements when you were trying to determine whether a person was an aide in healthcare, or to what level do they meet these requirements of being within that job position. But this is the visual representation of how we got to that eligibility requirements. All right. So these, and I think we shared in the materials what our online application demo looks like from a screen-by-screen basis. we wanted to make it as user-friendly as possible. Folks could complete this on their phones as soon as the window opened. But it had multiple steps, and then the primary, I guess, area of the application was the verification step. So, of course, we can verify on our end if someone's a resident or if they filed a return. But when we get into the more the items that we could not verify necessarily on our own, these became very important because the frontline worker would self-certify that they worked these hours, they were in this particular job. But this is what a step-by-step process of their application looked like. Jumping to the income requirements, again, that was $50,000 or less per person. We followed the guidance of what the CARES Act used for stimulus payments in terms of, it was 2020 at the time. So we looked at the 2019 tax return, and if it had not been filed, if it was on extension, then we would look to the 2018 return. But in the case of married individuals, we accepted if you had maybe two spouses that worked in the healthcare industry, they could have a total income of $100,000 or less for both of them to still be eligible. So that is actually double per person for those married filing joint returns.
Luke, do you want to discuss some of the issues with the income threshold with married filing joint?
There were quite a few. So, when we had situations where maybe you had two married individuals, let's say one was a doctor and one was a healthcare aide. The doctor may have been making $300,000 a year, but the healthcare aide was making $30,000 a year. So we had to approach it based on the actual applicant. So we had to separate ourselves from our tax world for a moment and focus in on the perspective of the individual applicant and if they met the threshold. But with that, Louisiana is a community property state, so there became all these issues of how do you know whose income to include for purposes of the application. What happens if they were eligible at the time we did this check, but then they filed an amended tax return and reported all this additional income that made them ineligible. So there was, while this slide might look like it was a simple check and process, there were various spinoff issues that we had to deal with as they came, because it was just items that we could not foresee at the beginning of the program. So it really was a moving target throughout the months that we administered this, with finding these new examples and putting out guidance as these issues were raised. Okay. And then this was the online application where they could simply check and if the 19 or 18 return had been filed and that it was less than the $50,000 threshold. And then we also, I guess, piggyback on that, we also ran into, we had some dependency and residency type issues. So the person had to be a resident of Louisiana, but we had folks that, during that 8-week period, maybe they came into Louisiana to work and then returned to a home state, or they moved away. So we tried to account for as much of that as we could, and then also with dependents. If an individual didn't file a return because they're under the filing threshold, but they still qualified for the program, we had a good many exceptions come through our automated process where it took an actual person within the department to review it and determine eligibility on a more manual basis when these, I guess, one-off issues would arise. Okay, so on the application method, well, because we had such a short turnaround time to implement this program, we focused heavily on doing an online application, like I mentioned. So it was available through, we piggybacked some existing functionality that we have that we use for taxpayers to file tax returns and make payments. Using that portal, we were able to create this application on our website. Folks would go through those steps, certify eligibility. They could attach documents, which we strongly preferred that they do, especially pay stubs or evidence from their employer that they did work those 8 weeks, because I would say between determining if they were eligible based on their job description and if they actually worked those 200 hours in the 8 weeks. Those were probably the more challenging aspects of it. So through the online application, we did allow folks to submit their pay stubs so that they could, on the front end, be verified much quicker. And then we, of course, wanted to provide for the folks, again, because we're dealing with lower income individuals that may not have access to the internet or computers. We did make paper applications available and had those translated in our 2 other most prominent languages here in Louisiana. I believe we sent those out through our public library system, so they would be across the state, and then they could submit the paper applications through fax or hand delivery even, or just by regular mail. Kevin, do you remember if I'm missing anything on that as far as the applications and the timing?
No, that's pretty much it. I know you put a lot of work into making sure that we had Vietnamese applications available.
That was a learning point for us. I did not realize Vietnamese was the 3rd most spoken language in Louisiana, but we did receive a few of those form backs, if I remember correctly. But we definitely wanted to do everything we could on the front end as being the administrator to make this as user-friendly and easy for folks, including those that English isn't a primary language. So this is where the fun starts, right? So we launched the program July the 15th at midnight. And Kevin, you want to let them know what happened at about 8 a.m. in the morning, if even that late?
Well, if you remember last year, and I see Commissioner Doty on the phone with all of the extensions with respect to COVID, the federal extension for filing individual income tax returns, but we granted an extension as well. And July 15th, actually when we launched our program, was actually the due date for the extended due date for tax returns last year. So as Luke mentioned, at about 8 o'clock in the morning, our system crashed. So our phones just immediately blew up. We started receiving calls about trying to apply for Frontline Worker Rebate. As you can see, this timeline shows 2 o'clock in the morning, and we have a very dedicated staff. We had employees up monitoring the site and making sure everything was running smoothly. So about, I'd say from about 8 o'clock to about 4 o'clock on the first day, our system was down. Now we were still receiving the applications, but they weren't being uploaded, and there was just a huge gap. So we actually had to extend our due date for tax filings an additional 2 days to accommodate the system crash. But so I guess at the end, we're going to talk about lessons learned, and I don't know if you're going to mention this, but one lesson that we learned is make sure you select the right date to launch your program if you're going to have an application process, because something like that could absolutely happen if your IT does not have enough bandwidth or support to be able to handle an unexpected download of applications or accessing of the system. So definitely a lesson learned. And you can see in the first week, how many applications we received. I mean, it was just a tremendous output, and many of those applications were duplicates, and we'll go into the numbers later. But yeah, we promoted the program, and applicants wanted their $250, and they were calling every number at the Department of Revenue that they could to see if we received it, when would they receive the $250. So definitely a lesson learned there. But Luke, do you have anything to add on day one, which was a crazy day?
That brings back all the trauma. It's still fresh in my mind. You know, and that was a Wednesday at that. So it was, and we launched it at midnight, and that's another thing I wouldn't suggest doing, because we had folks working all through the hours, Kevin and myself included. So So here is just a quick rundown of what our review process looked like on the internal end. So starting at the top, I mean, pretty straightforward. The application gets completed, it's submitted either by paper or online, we receive it. And then within our internal tax system, it would create what we call a case, meaning that case where it was an application case would be tied back to that person's tax return, so that it would match back to their income tax return to check on the income thresholds, whether they filed a return. So we did create that functionality within our internal system. From there, we pushed as much as we could toward automation, because at this point, I mean, like Kevin said, we hit that 200,000 mark right off the bat within a week. So we tried to push as much as we could in terms of residency, AGI, unemployment data toward the automated processes. And I'll come back and discuss unemployment data in a little bit when we look at some third-party data that we used. But that was very, very important to our process as well. From there, we would assign the cases out for manual review if they could not be fully automated. And then an individual person at the department would either approve it or deny the case, or that they would send a letter requesting additional information. Often that request for additional information was some way for us to verify that they did work those 200 hours during those specific 8 weeks. And I guess what was problematic with that, or on our end for automation purposes, was we were receiving data from our another agency, our workforce commission, that had information about whether folks were on unemployment or if they were actively working for a company. The problem was that other agency granted similar extensions the way that we did. So they also did not have data at their hands even to share about that 8-week period. So that is when we slipped and had to do a lot of the individual manual requests for information to make sure that we were approving the applicants according to the rules as well as the CARES Act. From there, if everything went smoothly, the approval, we'd issue a $250 rebate, either by paper check or direct deposit. We did have on our online application a screen where they could insert their bank account information. But of course, if we could not approve them for whatever reason, we did issue a denial letter. And then, like I said, the request for additional information, there were a significant number of those that went out. So in terms of the rebate payments, a few items there. We really pushed, we strongly suggested folks use their bank account information. It was a lot faster to get the funds to them. In case that, in a situation where they don't have a bank account, we did issue paper checks, but that was also during the time where there was significant delays in the postal system. So we really opted for direct deposit where we could. Another, I guess, area that our legislature had the forethought to consider was whether or not to offset these rebates. So modeling after the federal economic impact payments, the stimulus payments, these rebates were not subject to seizure or levy or garnishment by any entity, including the Department of Revenue for taxes, with the exception of child support and alimony. So we had to work closely with our Department of Children and Family Services to make sure that if there were existing child support obligations, that we did offset the $250 to the extent that we needed to. But again, that would be the only way that there was a prorated amount. It was either $250 or zero or slightly reduced because of an existing obligation. Another area that we ran into dealt with whether or not these rebates were taxable. So the legislation that created the program was silent as to taxability. So we had to look back at the CARES Act. We had to look at just general federal guidance. And we made the determination that these $250 payments, because they represented hazard pay, a form of compensation, that they were subject to tax at the federal level. So we did have to issue 1099-Gs to each recipient for their $250 rebate payments. And then, so because, and just as an aside for Louisiana purposes, if an item is taxable at the federal level, then it's also taxable at the state level. After we issued these 1099Gs in January of 2021, our legislature passed a law, a retroactive law similar to the federal unemployment, that exempted these from income. So we had a lot of amended returns that were filed to recover the tax on that 250. So I would definitely offer that as a recommendation as well. If you may want to, while in the legislative drafting process, determine whether or not you want this 250 million to be taxable. I believe under the American Rescue Plan that it likely will be, but for state purposes, you may want to go ahead and pre-decide that.
Right, and it's best to do it in advance because as an administrator at a revenue agency, it is very difficult to go back and to have amended returns. It's just an administrative nightmare. So please, lesson learned. As Luke mentioned, if you can give your commissioner absolute certainty on the front end, he can communicate that to the public to make sure that he's giving out the correct guidance.
Exactly. So this is when all of the dust settled and around, I think in December of last year. This is how the numbers ended up. So like I said, at the top, the grocery store staff and personnel, that was the biggest share of the program. And then you can see the amounts issued, the number of applications. And then at the very bottom, you'll see that we actually, at the end of the day, we issued out $38 million. So just a reminder that we had 50 million available to rebate out, but we only, once we reviewed all of the applications, removed all of the duplicates, we ended up with shy of about 50,000 available applications. So we ended up returning at close to $12 million back to our Treasury Department to, I think it was reallocated to some other relief programs. But this is, I think this goes to show when you are deciding who qualifies as a frontline worker, whether or not they're on the front line is their own question. But in an earlier version of our legislation, it was focused very heavily on healthcare workers. And you can see those folks, I mean, nurses, of course, and long-term care staff are at the top, but you see a lot of other healthcare related services at the bottom. We think mostly because they fell outside that $50,000 income range, but this is how our distribution ended up at the end of the day.
Right. Now, in actuality, we received over 240,000 unique applications. And I say unique because we had about 25,000 duplicates. So excluding those duplicates, we had about 240,000 applications. We actually denied over 82,000 applications based on ineligibility. One thing that I'll mention about the denied applications, one thing that the legislature was clear on was that fast food restaurant workers were not included in the essential critical worker rebate program. Because again, we focused on the 8-week period that restaurants were shut down, stores were shut down, pretty much our economy was shut down. So no thought was given to drive-through workers. So we had many McDonald's employees, Taco Bell, Wendy's. We had to wholesale exclude those because those individuals were not eligible for the Frontline Worker Rebate Program. It wasn't contemplated. So you had some unhappy individuals. So again, I would say make sure you target specifically who you want included, and specifically, if you can, who you're specifically excluding to give guidance. Because in the beginning of the program, Luke mentioned that we attempted to automate as much as we could, but in those last days of approving rebates, which we had to issue out all rebates before the end of last calendar year, we were actually going through requesting additional information about those jobs because the application wasn't especially clear. So it was a very tedious process in terms of approving applicants toward the end. And actually at the end, we ended up with just over 5,000 applications still in a pending status that we just simply could not get to.
And I think you said it best then. When we were so focused on deciding who qualified, we didn't put out specific guidance of who doesn't qualify. And I mean, the bulk of that was fast food workers. So I would take that for sure as a lesson learned. I didn't even think about that when we were putting this together, but giving specific guidance on who isn't ineligible, would be very helpful to the process, I think. So we've kind of probably hit on most of this already, but these I think are the lessons learned, maybe best practices if you want to call them. But first and foremost, like we've mentioned over and over, having that clear definition of frontline worker is pivotal if you want to have a successful program. Because ours, like I mentioned, pulled in the CISA guidance so heavily, we reached out to the Department of Homeland Security to ask them, how is it you developed your own guidance? Can we, can you share with us how you arrived at who is essential and who is not? And they were very forthcoming and said that this was written from the perspective of being broad and providing all of these employers coverage so that they still had their workforce coming in during the beginnings of the COVID pandemic. So what we ended up, I think, doing about halfway through the process, and I'm gonna switch screens right quick, or slides, we ended up preparing this employer certification form that I think turned out to be quite helpful. When we couldn't determine whether or not an employee was eligible, a frontline worker was eligible, we would then send this form to them for their employer to complete and then send it electronically back to us. So it did give us a little more coverage where we were getting more independent level certifications from someone's management or human resource folks instead of relying solely on the applicant and their representations. Another major area kind of within that same scope is the eligibility requirements. We had, like we mentioned, a definitive amount of time. It was that 8 weeks beginning right after the COVID pandemic public health emergency started with a 200-hour, which covered part-time work. And then we also had those income limitations that we discussed. So whatever requirements you decide to put on your own program, again, definitely want to make sure that that is as tight as it can be and the guidance surrounding that is as clear, plain language, and communicated out to the best that you can. Another area that we thought of was in terms of that front-end guidance, because I guess we did such a great job with this program. Our legislature has tasked us with a grant program that we are actively administering right now. The application started yesterday and we're way over mark again. But for this one, we put together what's an eligibility quiz where a potential applicant can walk through the eligibility steps without submitting an application at that time, but going through and seeing, do I qualify based on this or not on this? So instead of leaving them to their own devices to follow our convoluted flowchart, we have that online quiz for them to use, as well as a set of pretty in-depth FAQs. So we are taking that as our own lesson learned for our new program, and hopefully on the front end, giving out that guidance that we need to avoid denials on the back end. And then lastly, in terms of issuing out the payments, I think we've discussed that automation is where to go with it to the extent that you can. One thing that we did not have is status update availability. So when folks wanted to know the status of their application, they would call in to the department, they would send an email. If we had the time and if we could have done things differently, we would have really liked some type of online functionality where they could have entered their information and it would have told them where their payment is in the process or their application. And I think that would have done a lot to avoid the duplications that Kevin mentioned, with 40-something thousand duplicates, just because they weren't sure if their first application went through, or whatever the case may be. The verification process, that one was also a key component for us. We worked, like I said, closely with our LWC, our Workforce Commission, our Social Services Department, to make sure that we were sharing information. But that third-party data became just extremely important to the the overall success of the program. What we could automate on the front end, again, that's where we went with it. Another area that we did have, because we lacked information about who was employed at the time, we did have information about who was receiving unemployment benefits. So if they were actively receiving unemployment for those 8 weeks, then if they submitted an application, they were denied because they were receiving unemployment. You wouldn't be able to get this $250 rebate if they were also receiving unemployment benefits, because the requirements conflict with one another. And then lastly, and Kevin can probably tell you a lot better about this than I can, but it's all about having that dedicated team to staff this program and identifying the folks that can get the job done and in a timely fashion. Kevin, you want to talk about that one?
Yes, we had probably about 25 or 30 meetings just to make sure we got everything right. As you can imagine, this is outside of the normal duties for a revenue department, running a program like this. So to have it set up, getting the right people, and that was a process in itself, making sure we had the right people in the right seat on the bus to make sure that we ensured that this thing ran off as smoothly as possible. As I mentioned, day one, we tripped because the IT resources, but our secretary, one thing she charged us with was ensuring, she told myself, she told Luke, I want these rebates going out as fast as possible, and I want zero fraud. Now, any one of those two things individually, it's easy. It's easy to give out money, okay? But to make sure that you don't have fraud in your program, if you just ensuring that you don't have fraud, that slows down the entire process. So to do both, we had to make sure we had a team in place that knew when to push the accelerator, when to push the brake, and that's why we had that flow chart that went all over the place just to make sure we covered everything. Of course, with some of the verifications, I see we have some many legislators in Minnesota on the call. So you may give broad instructions to the revenue department, but the revenue department needs to meet, as Luke mentioned, with child and family services to make sure that child support isn't due. The revenue department needs to meet with workforce commission and establish a relationship to make sure that these were truly frontline workers and we aren't issuing rebates to those people receiving unemployment at the same time. So those are the kind of controls that we needed to make sure that we're in place to ensure as the least amount of fraud as possible. And when you do that, as much as possible, you want to automate the process, but you're going to have a manual component just to make sure that your I's are dotted and your T's are crossed. Because, hey, at a revenue department, you have an agency full of CPAs, accountants, attorneys, you have a professional staff, but still someone may not think of something. So that's why it's key to have a dedicated team to answer questions. Luke mentioned this status update and availability. If we had that in place, you take the burden off of our call center because they're receiving all of those calls. And again, it was at the same time as the extensions. So while they're handling those calls, they're handling calls with respect to a program that they normally don't have to deal with. So getting those Q&As out to those individuals to make sure that they're equipped to answer those questions that they normally don't get is imperative to the success of programs that you may be running.
I could not agree more with what Kevin said. And all of that considered, I mean, I think at the end of the day, we did run a very successful program. We didn't spend every single dollar available, but and $250, of course, doesn't go a very long way, but we did receive some some very thoughtful appreciation to those frontline workers that did receive these benefits and were able to use those to offset some of the costs that they were experiencing last year. So all in all, we do think we had a successful program, and so did our legislature because we're doing another one. But those are, I guess, where we stand with what we learned from it, and we hope y'all can take that as part of your development into your new one. But with that, we'll be happy to answer any questions you guys have.
Thank you so much, Mr. Morris and Mr. Richard. I do have a couple of questions, and you just hit on it right there, Luke. Was there any feedback on the dollar amount and maybe narrowing the scope of how many got it and going straight to long-term care workers or hospital workers and making it a more substantial amount? And then my second question was there any feedback on the income threshold from those who didn't meet the 50,000? Though they had COVID in their face equally as those who are under 50,000? Those are my two questions.
Yeah, so with every good compliment we received about the program, we likely did receive not such a favorable one in return as well. But in terms of the income threshold, I do know there were a few that expressed concerns that were just slightly over that 50,000 mark, but they were public health epidemiologists that were, actively screening folks for COVID. So we did receive a few, negative marks about the 50,000. Granted, that wasn't the department; that was what was codified in statute. So there was some concern about that. And then, I guess to your first question, when the bill was originally filed, it originated in the House of Representatives, and it had a much lower scope of who would qualify. The 250, I think, was always the same from the beginning, but the original version of the bill had a far fewer number of eligible positions. And as it went through the process and made its way to the Senate, amendments were tacked on here and there that expanded the group. And then that put us into the position where we were, where it's already not a large amount of money, but then had to be spread so far and then hit very other industries that, while we're frontline based, we're not within the healthcare realm. So we did experience a good bit of that.
Thank you. This has really been helpful. We've got some questions here. Representative New Brindley.
Thank you, Madam Chair, and thank you so much for the presentation. This was really helpful and insightful and interesting. My question is, I did not see it in your presentation, but I had heard, and so I'm looking for some clarification, that survivors of deceased workers were also eligible. Is that the case, and did you have a mechanism in place for those folks to apply?
Mr. Morris.
Yes, actually, we just flipping back to our application screen, we had a step for deceased individuals. Not obviously because they were on the front lines and they were being exposed day in and day out. We wanted to make sure that if a person who was eligible, who did meet the requirements, but subsequently passed away for whatever reason, that their survivors had the ability to claim that $250 on their behalf. I was actually looking at statistics right before this call, and we had one decedent rebate issued to surviving family members. So it wasn't many by any measure, which is also good, but we did want to make sure that we provided for those folks who may have passed away after meeting the eligibility requirements.
Excellent. Thank you.
Thank you. Commissioner Doty.
Thank you, Madam Chair. And I also want to express thanks to the Louisiana Department of Revenue. This was a very, very good presentation, very helpful. Two questions I have. First is, I'm just curious, is Louisiana a gen tax state in terms of your integrated tax system? And is that what you guys then, I'll say tweaked, if you will, for automating this purpose? I guess that's one question. And the other question, I do want to also ask about the resources so you talked about the dedicated team that you put together. Did you guys have to hire additional staff? Because I know one of the things that is weighing heavy on my mind is the, how we prioritize this with the normal tax work that's happening. And you alluded to that in your presentation, but I'm just curious, then how did you address that? Because it was all happening all at the exact same time.
Mr. Richard, I think is ready.
Yes. So first question, yes, we are a Gentex state, and yes, we did utilize our on-site staff to assist us in building the program to allow for the cases so we could review the application. So yes, we absolutely utilized the staff at Fast Enterprises. The second part, Luke, you can add on, but I mentioned earlier, we had a Main Street recovery program that was $275 million. That program allowed for the Treasurer's Office to retain 5% for administrative costs. Unfortunately, for some reason in the Frontline Worker Rebate program, it did not allow for any administrative costs. So we had to, we had to figure it out. And I don't know if you have any insight on, maybe it was just an oversight on the lack of administrative costs allowed for the program. But in our new program, as Luke mentioned, because we did it so well, we are allowed a 5% retention for administrative costs. And of course, we always try to mitigate costs as much as possible to allow for more of the funding to go to those in need, whether it be small business, nonprofit, frontline worker. But unfortunately for us, we were able to do it, but zero administrative costs.
Wow. Thank you.
No, so good catch. And please make sure if you are running a program, you all afford Commissioner Doty some administrative costs to run this, because there are costs associated with this.
Okay, thanks, Commissioner Doty. To that point, Mr. Richard, so you now are doing the 5% for your next program going forward. So your administrative fees would be 12 million, 12.5, something like that.
Well, this new program is $10 million, so the 5% would be up to,
okay,
right? But we still would have to prove up the expenses. It's not just a flat amount. So, you have to show receipts and the costs and whatnot. And, we're a revenue agency, so primarily they're flow-through costs. Whatever the agency is charged, just more of a reimbursement.
Thank you. Representative Frazier.
Thank you, Madam Chair. Thank you, Mr. Morris and Mr. Richard, for your presentation. It has been informative. I have a few questions, but I'm not going to ask them all because I don't want to dominate the time. But I do want to ask, was there any support for individual applicants to help them file those applications for the rebate? That's one question.
Mr. Morris.
So in terms of support, we did work with a few stakeholder organizations, primarily just to push the message out there that this program was available. So through working with them, I think that may be limited to the only support that we were able to provide, because this was piggybacked off of an existing rebate program. We're a little more limited in being able to offer assistance to fill out the application. Now, granted, we had our folks manning the calls and the email communications, and when questions were asked, we of course answered those, but we didn't have any, third-party services that would prepare applications for anyone. The goal was to keep the application itself as simple and straightforward as possible, so you wouldn't need to. Now, granted, later in the process, there was a in the application process, there was a step where if you were preparing this on behalf of another as a third-party preparer, you had to disclose your information, and there was just a few hundred of those. But we did allow that, of course, but we didn't provide any services ourselves in terms of assistance.
Right, and that was intentional, just to make sure that those critical frontline workers were the recipient of the entire $250. So a lot of emphasis went into ensuring that the application was simple, and we got the word out that everyone, as much as possible, knew that we were administering this program, where to go, and how to fill it out. So as you can see, what's on the screen, we tried to go with yes, no, so anyone could fill out that application.
Thank you. And Madam Chair?
Yeah, Representative Frazier.
Thank you. And just to follow up, the new program, is it similar to this current one? And was this new program put in place? I know you said you were very successful in the first one, so good work means more work, so I get that piece. But was the new program to capture more frontline workers?
Mr. Richard.
No. The short answer is no. So the new program is to assist nonprofits and small businesses. It's a much smaller scope. So it's Luke mentioned earlier, it's a grant program where eligible nonprofit organizations and certain small businesses are eligible for grants for up to $25,000. It's a $10 million program. Do the math. If it's zero administrative costs, you're looking at a minimum of a maximum, I don't know if I'm getting that right, of 400 applications. If everyone was granted the 25,000 maximum, we will have up to 400, a minimum of 400 applications. And Luke, do you want to go into what the small businesses, oh, he has it up on the screen, the eligibility requirements.
So the programs that were running last year, like Kevin mentioned, the Main Street Recovery, they weren't available to nonprofit organizations. So somewhat of a similar thing happened with this piece of legislation. It originated in the House, being designed strictly for nonprofits with a $50 million funding. And as it made its way to the Senate, that dollar value went down from 50 to 10 million, and it added in small business. So we launched this program yesterday, and we already received more applications than we could fund, which isn't great, but there is an opportunity to provide some excellent resources to those. For nonprofits, the focus is that they will use their funding up to $25,000 per nonprofit to provide food or education or employment assistance for their communities, whereas small businesses need to use it for workforce development activities to build up their workforce to make Louisianians more resilient to COVID and public health emergencies like this in the future. So this is aimed more at an activity that we're trying to drive in the future. We're trying to grant funds, and then they will go and incur their expenses using those funds to have assistance programs themselves or develop their workforce, and then they'll account to us on the back end. Whereas the Frontline Worker Program, they had already performed the activity that resulted in them receiving a rebate of $250.
In order to ensure the success of the program, prior to the implementation yesterday, we met with certain faith-based leaders around the state. We also met with certain nonprofits, the United Way, Louisiana Food Bank, just to have their thoughts on how we could best run this program. So we've incorporated that into some of our guidelines. Luke did an excellent job of coming up with program guidelines for this new program. We hope it's as successful as the critical frontline worker program that we ran last year.
Thank you.
Thank you, Madam Chair.
Thank you, Representative Frazier. Senator Kiffmeyer.
Thank you, Madam Chair. Thank you very much, Mr. Richard and Mr. Morris, for your presentation. It's very helpful. And especially I appreciate the materials. I like the flow chart. Very nicely done. So the question I have for you, what was the cost to build the software? I understand you did this with your own resources. It seems as though you built it in-house. And so, but do you have kind of a general cost and how long it took you to do so?
Mr. Richard.
I don't know if we tracked that. Luke, do you know, since
Because we knew we weren't going to receive any type of reimbursement funding, I don't believe we measured our time or the efforts that we put into it. I mean, I'm sure we know in terms of what it took to develop the online application in terms of IT costs, but in terms of human cost and the amount we spent answering a phone call and developing guidelines, we did not measure that. But I will tell you, we had a significant amount of resources put on it. We wanted to make it as successful as possible. So we had the best and the brightest of the department working towards this and spending some significant time on it. But it was all for a great cause at the end of the day. Right?
Thank you, Madam Chair. I think that's probably the biggest thing. Did you say how long it took you once you were directed to do so? How long did it take you?
Kevin, what did we have? 2 weeks? Was it even that much?
2 weeks.
it was right?
Wow.
Yeah,
You are great. That is absolutely phenomenal. 2 weeks, Mr. Richard.
the session ended at the end of June, and I think we were live July 15th, right? Yeah.
That is phenomenal.
Yeah, you got some big shoes to fill, Commissioner Doty.
Yes. Yes, I think Minnesota and Louisiana sounds like a very good lessons learned, and commend you for that. So that answers my two questions, Senator, Madam Chair. And I would say all the other questions have addressed things that I had as well. I think most of this is for us in Minnesota, like some of those things. And I know the other one was when you verified some of these things that you verified, because this was done through Department of Revenue, you had in-house already those kinds of verification records to work with, or did you have to go outside the Department of Revenue to verify?
I would say it was a mix of both of those. When it came to tax returns, such as the income and the residency status, we had all of that available at our hands. And then we worked with the Workforce Commission to receive, I think we were getting weekly files of their unemployment data sent over and then incorporated into our system so that it could be automatic checked. When it got to more of the manual process with the reviewers, I think they were using whatever third-party information that they could use to confirm employment, like if the employee is listed as an employee on the website of the particular business. So it was a good mix of both, so that we had multiple avenues to check data against.
One follow-up question, Madam Chair.
Senator Kiffmeyer.
So, Mr. Morris or Mr. Richard, in regards to that, did you include anything in legislation requiring the other entities to cooperate with you without cost?
We did include in the legislation, because of the data that we have is so confidential, we opened up that confidentiality provision to be able to receive some of the data. But I think by and large, we used existing statutory authority and operating agreements with the other agencies, but none of that provided for any cost sharing or anything like that. I think all of our different agencies, we just bore our individual costs on it.
Thank you very much, Madam Chair. That's very helpful.
Thank you, Senator Kiffmeyer. Senator Murphy.
Thank you, Madam Chair, and thank you, gentlemen, for your time and for filling in our thinking about what you accomplished in Louisiana. I have one specific question about the form and then a couple of evaluative questions. So the first is, in the form, you required an employer to participate. What if an application came in and an employer didn't didn't fill out their share of the paperwork, what happened then to that person's application?
So actually, and to clarify, so the employer certification form, we created that and implemented it about halfway through the program. We did not realize until we had received 200,000 plus applications that we were having the trouble we did with verifying the employment and the hours worked. We relied on a lot of them to submit their own pay stubs with the application. So that handled the bulk of it, but those that we could not independently verify, we came up with the idea to have this separate employer certification form and then rolled that out, I think, within a month or so of the program launching. So that was a later process that we added as a control.
Right. So if we were able to verify that they were in a qualified job, they did not receive unemployment, everything else, we were really trying to get the money out. So as Luke mentioned, in the midst of the program, we came up with a process to those applications that are quote unquote stuck, have the applicant to submit that form just to make sure that we were checking everything upon an audit, because we're dealing with federal funds, to make sure that we had the necessary documentation to substantiate the program that we were running.
Madam Chair.
Senator Murphy.
Thank you, Madam Chair. And so in your experience, did you encounter occasions in which an applicant didn't receive the funds that they were entitled to because an employer didn't fill out this part of the paperwork?
I think by the time we had rolled out the employer certification form, we were starting to wind down the program because we were getting closer and closer to that $50 million mark. So when we did receive back those forms, we obviously processed those applications and issued the rebates. And then I think once we reached the December date, because I should have also mentioned, we were running down a December 31 deadline. The CARES Act had mandated that you have to spend these funds or they need to be reallocated or they'll have to be returned to the U.S. Treasury by December 31. So as we hit toward the end of November and the beginning of December, if we had not received back the employer certification form at that point, then those applications were closed, just with the expectation that we would not receive it back. But anyone that we did receive it for, those applications were processed as long as it was while the program was active.
Madam Chair.
Senator Murphy.
Thank you, Madam Chair. Just two more, and they're evaluative, so hopefully help with everybody. The first is, do you have an interpretation of the rush, why you had the crash, not the systems part, but why are you so successful in getting so many people to apply so quickly?
I would say it was probably a coordinated effort between the department and the members of the legislature. I mean, obviously we put out our own press release. I know the secretary was on a few different morning news stations explaining how the program works. And then we sent information pertaining to it to every district office of the members of the legislature. They reached out to their own constituencies about it. So it was through that, I believe, that coordinated effort working with our stakeholders to make sure folks knew that the program was available to them.
Thank you. And Madam Chair, just one more.
Senator Murphy.
Thank you, Madam Chair. When I looked at your list of those who received the hazard pay and the distribution of who, in analysis or an evaluation of the program, do you have critique or advice for us about who was actually included and the distribution to whom was included in terms of the way you thought it would work and the way that it actually did work? Did Louisiana, as you put this together, have a sense of where you thought the money should go? Or were you agnostic about that and it just happened the way it happened?
Mr. Morris.
I would say that, so as the bill was amended throughout the process, I mean, from the original version of the bill that was primarily more focused on healthcare workers, and then as it was amended throughout the process to add additional categories, each time we had to attach we worked with our legislative fiscal office to attach a fiscal note to the instrument that would explain what we estimated in terms of population, who would qualify based on the job categories. I know we use census data, workforce data, whatever we had available to come to estimates. So I don't believe anyone was surprised that grocery store workers would be, and gas station type workers, they fall in that category as well. I don't think anyone was too surprised that they would be the bulk of it, because we did prepare estimates before the bill was finally passed. We knew we were going to have somewhat of that level of distribution.
And Madam Chair, just one follow-up.
Murphy.
Thank you, Madam Chair. I really appreciate that. You know, we're not in the same place you are. You are looking back and we're still moving forward through this. So do you have advice for us about, you know, in retrospect, how do the people of Louisiana feel about this targeted effort? Did they have feedback for you that you would share with us?
Mr. Morris.
You mean in terms of the individuals that receive these funds, or?
Yeah, was it viewed successfully? Did the people of Louisiana think, yeah, those are the right people, they deserve to get that, we're happy about that, or other?
I would say that, you know, if we could do things differently, you know, the $250, that is what was available from the CARES Act. CARES Act was not nearly as large as the American Rescue Plan. There were several different competing interests over those CARES Act dollars. So the $250 was what it was, and it did go to a great use and helped out those folks that were in need and compensated them for their frontline work. But if I could offer just as a recommendation, the $250 is, if you have the ability, which you do, I think with having 5 times the amount of money that we did and only I think about 1 million more residents, if you could make those payments a little more sizable, that would be my takeaway recommendation. I mean, apart from everything else we covered, I would probably offer larger payments, either in terms of a one-time payment, or I know some states have increased the wages, hourly rates of employees. That would be my suggestion at the end of the day, just so that this money goes to the most impactful use that it can.
Right. And I would say it, in terms of the response or acceptance of the program, I would say it's a mixed bag. As we mentioned, a significant portion of these programs that we ran from the CARES Act funding came from the local allocation. So of course, you had a shortfall with the locals where they were trying to balance their budgets and whatnot, and so that significantly reduced the amount of funding available to the locals. As I mentioned before, we excluded fast food workers from the program. So I'm sure that they weren't too happy with the eligible worker category. And to your previous question about what did we attribute our success to, or getting the word out, or getting so many applications in that first week, I think it can't be overstated, word of mouth. So if you had someone working at Walmart, I'm sure they called a coworker or someone else they knew that was in that industry, or someone working at a nursing home or an elderly care facility, to let them know that, hey, this money is out there and available. And I think that drove the application, the number of applications up as well.
Thank you very much, and thank you, Madam Chair.
Thank you, Senator Murphy. Commissioner Robertson.
Good afternoon. Thank you, Mr. Morris and Mr. Rashad. It is always wonderful to see my great home state being supportive of other municipalities. So thank you for the informative presentation. You talked a little bit about focusing on the simplicity of the application, but did you do any other significant outreach because of your quick timeline, what did you do before you opened the applications up to ensure that those that this was intended to had the information and was prepared to make application?
Right. Well, as Luke mentioned, we had a press release that we issued. Luke, I'm not sure if the secretary actually spoke on TV about the program, or did we?
I know when she did press appearances, she spoke heavily on it. And then I want to say, I mean, in terms of grocery store, it's no surprise that in Louisiana, Walmart was probably our largest segment that shared in the funding in terms of their employees. So we did reach out to a few employers that we knew on the front end would have a massive amount of qualifying employees, frontline workers. So I know we took some steps there. And then other than that, and reaching out to the members of the legislature and their home offices, I think that more or less covers our outreach efforts.
Any coordination, Madam Chair, any coordination with any nonprofits or any other worker organizations?
I think I did. When the bill was going through the process, I think we had a good many conversations with our, I'm drawing a blank. There's a few employer-based organizations here in Louisiana. The National Federation of Independent Business. I know I worked with their representative, and they pushed out information via their newsletter to businesses that may have eligible employees. I would think we probably did reach out to a few nonprofits, but none are coming to mind. But I know there was leading up, and granted, it wasn't very much time to get this program up and running, but in those few weeks that we did have, I know there was a lot of coordination across that, and we may have reached out to nonprofits, but I do not recall it right now.
Thank you. Madam Chair, one more question, please.
Commissioner Robertson.
I know you're preparing for your new funding stream. Is there, and if you don't know the answer to this, it's okay. I think we can find the information otherwise, but as you are preparing for the next round of funding, have you noticed anywhere in the American Rescue Plan if there's any provision for allowing for premium pay or payment under financial hardships?
That is not something I know the answer to. Our current program is focused on granting funds to business and nonprofits and not to individuals. So that is familiar about the premium pay, but I have not researched that in any depth to be helpful.
Okay. Thank you, Madam Chair. Thank you both.
Thank you, Commissioner Robertson. I have one more question I was thinking of. In the American Rescue Plan dollars that Louisiana is getting or got, is there any plan to set some money aside to maybe do a round 2 of hero pay dollars?
Not that I am aware. I think all of the available funds from the ARP were allocated toward this new nonprofit and small business program, with the design that it would then pass along to Louisiana's workforce one way or the other. And then there were a few other programs that were created. I think the Main Street Recovery was given additional dollars, a few very specific industry programs, but I don't believe there were any funds allocated to go toward frontline workers directly through a similar program that we had last year.
Thank you so much, Mr. Morris. Representative Frazier.
Thank you, Madam Chair. Mr. Morris, there was a question asked earlier around the employer certification part that I think you all added. I think the way you described it was toward the end of the process when you were struggling with verifying some of the employee for some of the sectors or industries or jobs. I just want to get some clarity. When you implemented that piece to the process, would it have been possible for the resources to be held up and not distributed or allocated to the employee if that employer did not respond?
That is a good question. Because we implemented it later in the process, I don't believe we have probably the best information to offer a response to that. In terms of at least what I saw and what came across my desk is that multiple employees would submit the same form to the employer, or the employer, the form was available online. The employer may have been a little proactive and found the form themselves and sent it in. But we would, I believe, receive many of those in bulk, where one human resource individual at a certain employer prepared it for 20 different employees and submitted it to us. But I don't know of any situation where a rebate was not issued because an employer was withholding that form. It could have happened, but nothing was ever raised to my attention.
Thank you.
Thank you, Representative Frazier. Members, are there any other questions of Louisiana? Mr. Morris and Mr. Richard, thank you so much for your presentation. It was extremely helpful, and like Representative New Brindley said, it was very, very interesting. So again, thank you very much for your presentation, and I'm sure Commissioner Doty will be calling you. Thank you.
Forward to having us.
Thank you. Next up on our agenda, we have the we wanted to talk about what eligibility criteria we'll be using for the rubric for consideration of this hero pay. And I got a text from Representative Winkler. He's listening, he's in the committee, but he is driving right now and he really wants to be part of this conversation too. And he was hoping maybe we could push it off till Thursday to have this conversation about the eligibility criteria. Representative New, you have a question as to this?
It would be something I would love to have answered before we have that conversation. So you
Yes.
can continue, or I can ask that when you're done, or now, whatever is your preference.
Go ahead now.
Okay, thank you, Madam Chair. And perhaps this question is for our friends at the LCC. I'm not sure, but there was discussion. Clearly, we are using different funds than Louisiana used with the American Rescue Plan. And I'm wondering if we can get a definitive answer on those federal income threshold requirements. It sounds like Louisiana just directly used that federal number of 50,000. And I'm wondering if we have a definitive number for the American Rescue Plan money.
And Ms. Weber.
Madam Chair and Representative New Brindley, Bjorn Arnson, Nonpartisan Senate Counsel, is available and prepared to give you some information on that.
Madam Chair and members, members may recall from our very first meeting that we outlined for the working group the kind of basic requirements of the American Rescue Plan Act and the associated rule. And specifically to Representative New Brindley's question about the income thresholds, with regard to the premium pay eligible use under ARPA, the premium pay is an amount that doesn't exceed $13 per hour for an individual worker, and in aggregate can't exceed $25,000 per eligible worker. And the rule suggests that that's kind of a hard limit at the top end. The rule also provides some guidance that I'll just quote from the rule. Quote, if premium pay would increase a worker's total pay above 150% of their residing state's average annual wage for all occupations, or the residing county's average annual wage for all occupations, whichever is higher, then under that condition, the state would have to provide some additional documentation to Treasury and make public available a written justification of how the premium pay or grant is responsive to workers performing essential work during the public health emergency. And just as a point of reference for members, last time I looked, I think the average annual wage across the whole state was, I think it's just short of $60,000 on average. So that's kind of the ballpark for 100% of the state average. And of course that would vary, somewhat widely by county, but others may have more accurate or more updated data on that.
Representative New.
Thank you, Madam Chair. And thank you so much, Mr. Arneson. That was very helpful. And can you just clarify that 150% of average? So it's 60,000. So we'd really be looking at 90,000. Am I understanding that correctly as a cap? And are you saying that is that a hard cap, or do we need to give an explanation for why we would distribute funds above that?
Madam Chair and Representative Brindley, I read the text of the rule to mean that it's not a hard cap, that 150% threshold isn't a hard cap, that it would be possible to design a premium pay program that would offer premium pay to relatively high income people, but that in these cases, the state must provide Treasury and make publicly available a written justification of how the premium pay or the grant is responsive to workers performing essential work during the public health emergency.
Representative New Brindley.
Thank you, Madam Chair, and thank you, Mr. Arneson. That was very helpful.
Thank you. Senator Kiffmeyer.
Thank you, Madam Chair. This is going to be a question for Commissioner Doty. This question has to do with, are these funds that are sent out to whoever the recipients are they taxable by Minnesota state law and federal law?
Commissioner Doty.
Madam Chair, Senator Kiffmeyer, actually, I think we have been asked to provide a presentation on that very point next week. And so we'll be glad to know that we do that. But I think that what I will tell you, I believe that as we heard from Louisiana, I do believe that these potentially are taxable federally, which we would have potentially nothing to do with. But again, we have to see how that works with the ARPA funds. And then I think we have to talk about how that from the state perspective, and maybe that's something legislatively that that we would deal with. But we're going to specifically focus on that next on our presentation.
Great, thank you, Madam Chair. I'm glad to hear that there'll be more of a presentation on it, and I think that Commissioner Doty needs time to do so. It's something that we should consider as well, especially the things that we are empowered to do. And in regards to the criteria on Thursday afternoon, I was looking forward to today. I was a bit disappointed here that we put it off another time, but considering the situation, I know we've all had different situations, but if we need to change this, but I'd like to be sure that all members of the work group, though, can be available Thursday afternoon before we make a change.
Thank you, Senator Kiffmeyer. I too, if we're doing this on Thursday, I just want to make sure that we allow enough time for us to discuss this criteria. I know there's a long list of testifiers. So I guess I'll pass that off to Senator or Representative Winkler to make sure that maybe we can limit the testimony so we have enough time to discuss this criteria. And I don't know, Representative Winkler, if you can talk while you're driving or you're just listening, but I'll talk to you offline to see if we can get that testimony tight so we have enough time to discuss what our criteria is. Members, is there anything else that you wanted to talk about before we adjourn? All right, with that, the meeting is adjourned until Thursday.
Recording stopped.